For many, life in Yemen was already difficult before the coronavirus. Now the pandemic is making things even worse. Over the last 2 months, more than 20,000 families have turned to camps like these in the Marif Governorate. Their homes are now makeshift tents. Healthcare here is limited, social distancing impossible. The UN says Yemen's healthcare system has essentially collapsed.
We hear from many of them that Yemen is really on the brink right now. The situation is extremely alarming. They are talking about that the health system has in effect collapsed. They are talking about having to turn people away because they do not have enough oxygen. They do not have enough personal protective equipment.
Doctors are getting ready for a rise in the number of patients, but they have little to offer them. Yemen is particularly vulnerable to the spread of the virus. Poverty and water shortages have left the war-torn country highly susceptible to disease, and money is running out.
We are heading towards a fiscal cliff. If we do not get the money coming in, the programs that are keeping people alive and are very much essential to fight back against COVID will have to close. And then the world will have to witness what happens in a country without a functioning health system battling COVID-19.
Aid agencies say infections are likely underreported because of scarce testing, limited resources, and government secrecy. And calls to stop the fighting amid the pandemic have been ignored, leaving even more people at risk.
Were forced out of their homes by armed men, conflict, violence. This is a damning verdict on international diplomacy, on the raw violence of armed groups, but also of the Security Council, which has not in any way supported the Secretary General's call for a global coronavirus ceasefire.
5 years of war between allies of Yemen's government and Houthi forces have destroyed or closed more than half of the country's health facilities. People are now left facing a disease that threatens to further cripple their country, already devastated by war. Katia, Lopez-Hodayan, Al Jazeera.